Good afternoon, everyone. I'm Charles Lee. I'm the director of the Jackson Laboratory for Genomic Medicine. And it's my pleasure to have you all here together to commemorate and have this special dedication ceremony. Thinking about this event, I thought about the fact that 19 months ago, Edison Liu, Luann Ballesteros, myself, went to the governor's office to offer the support of Jackson Laboratory in testing for SARS-CoV-2 virus for the citizens of Connecticut. We asked the governor if this was something that he needed, and both he and Josh Gabel basically said, yes, definitely, we really need your help. We need everyone's help together to get through this pandemic. And so we were really delighted to be to help contribute to this. And in 2 weeks, record speed, we converted the CLIA lab that we had that was doing primarily cancer testing into a lab that was able to do SARS-CoV-2 testing. And with that, when we started doing the testing in the laboratory, we started by testing about 100 tests, approximately 100 tests per day. But quickly, with the help of Rich LUSSIER, who you'll hear from shortly, and his fantastic CLIA team, ramped up the testing at the Jackson Laboratory for Genomic Medicine from about 100 per day to over 10,000 tests per day. And this accounted for about 23% of all the PCR tests run in the state of Connecticut for SARS-CoV-2. And we're really pleased to be able to do that. But really, to make this testing possible, we also needed a partner for the collection of the samples. And UConn Health, of course, was fabulous in being able to establish these collection sites, initially in parking lot 3, and then moving to garage 1. And I can still remember going through those collection sites. They had a wonderful drive-through service for us. But the clinical UConn Health staff, I watched as they tolerated adverse weather conditions, the cold, tiredness, but provided a constant ability to collect samples, which then went on for PCR testing. And then, of course, in January 2021, when the vaccines became available, UConn Health again stepped up to the plate and started to administer the vaccines in a very efficient manner. More than 40,000 vaccinations at this site alone that they've been able to administer for their employees, for our employees, and for the community around us. So I really hope that we'll continue to remember the sacrifices of so many at the two institutions that were made for all of us to get through this pandemic. And this is the reason why we're here today, is to have this commemoration where we will, as we continue on, that we'll be able to remember all the sacrifices and the fact that we've gone through this together. And I'm told from many experts that this will not be the last pandemic that we'll go through in our lifetime. And I can honestly say that I'm really grateful that I know that when we go through the next pandemic, we're going to have UConn Health as our partners, and we're not going to go through this alone. So with that, I'd love to hand the microphone over to Dr. Andy Agunobi, who is the CEO of UConn Health and interim president of UConn.
Thank you, Dr. Lee, and thank you everyone that's here today. I particularly want to thank our commissioner, Dr. DEIDRE Gifford, commissioner of DSS, who's here with us today and has just done a phenomenal job in the state in helping us to be as safe as we are today. So I'm honored to be joining all of you today to commemorate the amazing team effort of the staff and researchers of the Jackson Laboratory and UConn Health towards combating the COVID-19 pandemic. I particularly want to congratulate the Jackson Laboratory under the leadership of President Ed Liu and the scientific director Charles Lee for having the vision and the courage to lean into the pandemic and retool quickly, as you just heard, to perform testing. It was just an amazing effort, and one that I think helped change the trajectory of our state at a time when testing was the big word. If we could solve the testing, then we knew we could get through this. And they just showed the value and the amazing work that the Jackson Laboratory does. So I want to thank them for having that vision. I also want to thank Dr. Bruce LIANG, Dean of the UConn Medical School, Dr. Enrique Ballesteros, who's chair of the UConn Health Laboratory, and his staff who are here today, as well as our information technology staff, and of course the vaccination teams that Charles Lee talked about, and others, for again leaning into testing, vaccinations, and other necessary collaborations, including information technology. I'd like to also be remiss if I didn't thank the Governor's Office and all of the other state officials for providing the ecosystem and the support. And I remember in so many of these discussions, people from the state saying, whatever you need to get this done, we're there for you. And you see where we are today in this state. We're all proud to be in this state when we look at what's happening across the nation. And we hope that all other states follow the same pattern of getting to where we are today. So the Governor's Office, state officials provided that ecosystem and all the other means of assistance necessary to foster the collaboration between our two organizations and allowing us together to respond in the best way possible. Finally, I want to recognize the frontline healthcare workers, the nurses, the physicians, the medical assistants, technicians, laboratory staff, many of whom were actually staffing those collection sites, but if they weren't in the collection sites, they were in the labs doing the work that needs to be done. They did this at great risk to themselves. If you remember, and also their families, if you remember, in the month, this all started in the months before vaccines were available. So people were taking actual personal risks to do this work that we're talking about. Now we have vaccines, we think, well, it's relatively safe, but it wasn't that way in the beginning. So they did this at great risk to themselves, and they played a key role in getting us to where we are today. UConn Health has always collaborated with the Jackson Laboratory since they have been here. And that, as can be seen by our joint hires and millions in joint grant funding. But the response to COVID-19 is a case study, in my mind, of how two complex organizations can come together rapidly, retool, innovate, collaborate, and support each other to help keep the people of a state safe. It resulted in what we know happened, and that was about 1.5 million SARS-CoV-2 tests conducted and more than 40,000 vaccinations administered to date. But just as importantly, it deepened and broadened the relationship between UConn Health and the Jackson Laboratory. It deepened and broadened the mutual trust and respect between the two organizations, and that sets the foundation for even more research in future and for responding to whatever might come down the line in future. Collaborations that will benefit Connecticut, but I think will benefit the whole nation and maybe even the world as we do this work together. So congratulations to all of you for your inspiring, productive, and successful work, and onwards. Thank you.
It was on the late afternoon on a Friday, the 6th of March in 2020, when four of us were gathered in Charles's office. Actually, three were there, and I was on video, but four of us were there. And that's the meeting in which we discussed what Jackson Lab could do, what the CLIA Lab could do in order to meet the need for testing in the state of Connecticut. And it was a great decision that we made to explore what we could do from a testing perspective. From that day, the 6th of March, about 2 weeks later, as Charles said, in fact, in between those dates, we assembled a team of roughly 57 people from 14 different departments within Jackson Laboratory, 2 different campuses, including information technology folks for sure, as well as the laboratory, people in the business area, attorneys, everyone was gathered in that team and proud to be part of that team to implement the decision that we had taken on that afternoon of the 6th of March. So within that 57 people, or within the group of 57, I have to say that there was a core of roughly about 9 people, 2 of whom are standing amongst us here, actually 3 are standing amongst us, who actually worked 300 or more hours in the month of March alone in order to get this test off the ground. It was amazing. It was something that I had never seen, and what they had done is not only develop, but they optimized, validated a test in that period of time when EUA was not even part of the lexicon yet. No one had heard of what an EUA was, but we were actually going through it and doing it. These folks sacrificed time for their family, their friends. They were living through a trying time for all of us, but for them especially, the amount of work that they put into it was certainly above and beyond. And it's because they knew that we had to improve the situation for testing, and we had to deliver those results faster for the patients, for our healthcare partners, and especially also for the families who were just waiting way too long to get COVID-19 results in that time frame. So some 30 weeks later from that decision that we took on the 6th of March, we were delivering 50,000 tests in a week compared to 175 tests in the first week that we ran. We hit a peak of about 12,000 tests in November of last year in a single day. It was an amazing team effort, and as we heard, actually closer to 1.6 million than 1.5 million tests now. But it was an amazing team effort, and we're really proud of what we did. And I'd really like to thank the folks from the CLIA laboratory, from the IT groups, and from every other group within Jackson Laboratory that helped us work as closely as we could and together in order to get to that great goal and achieve it. And also like to thank all of the great folks that we worked with. Enrique and I were just reminiscing about how we used to get together on a daily basis at 8 o'clock in the morning, every morning, for 5 days a week. And then it went to 3, and then it went to 2, and then it went to 1. And now we don't have to talk every week. But we miss it. With that, I'd like to call Dr. Liang.
Good afternoon, everyone. And I want to thank Dr. Andy for his leadership during this time. Always enjoying whatever I could do to be part of your team and the panelists during those weekly town hall meetings at the peak of the pandemic. I also would like to echo Dr. Andy's comments about the strong leadership of the governor, commissioner, and would really appreciate everything that you have done to help us navigate through this once-in-a-lifetime pandemic. Thank you everyone for coming together today to celebrate our strong and growing UConn Health School Medicine JAX partnership. Together, since 2014, we continue to increase our scientific collaborations, recruiting world-class scientists and physician scientists in co-hired joint faculty, and produce much-needed scientific breakthrough to improve personalized patient care in Connecticut and around the world. There's nothing that we cannot do together. From growing beating heart tissues in a dish to sending mice to the outer space and then battle COVID-19 virus side by side. Over the last 20 months, we have risen to every challenge of this once-in-a-lifetime pandemic, together with our state to quickly meet the critical needs for greater COVID-19 testing, as you already heard so elegantly, vaccination, and also COVID-focused research insights between our scientists, our clinicians, our human subject study coordinators, and the scientists at the Jackson lab. And I'm very grateful to work with some of the outstanding colleagues and leaders at JAX, Dr. Addison Liu, Dr. Charles Lee, and their dedicated staff. It's been a truly collegial and collaborative relationship, and I hope this is just the beginning of a very long, beautiful relationship. Thank you very much. And I'd like to ask Commissioner Gifford to give her remarks, and thank you so much for being here with us today, Commissioner.
Thank you so much for including us in this afternoon's really lovely ceremony. It's just looking at the display here, I was thinking how important it is to commemorate the work that's happened during the pandemic, for us to remember. Hearing everyone talk about March, it seems like almost a lifetime ago, and I was picturing sitting in conference rooms not wearing masks early in the and all the things that we've learned and all the things that have changed. So I really congratulate JAX and UConn for taking the time and effort to put this ceremony and this commemoration together, so that years from now we can all reflect on the challenges, the opportunities, and what was achieved in the course of the pandemic. I also want to congratulate the parties for the partnership that's been described here this afternoon. I think those kinds of partnerships have been critical to the success of the state of Connecticut in protecting as best we could the health and well-being of our residents. When we think about the pandemic response in Connecticut, I think one of the things we were just reflecting, one of the things that differentiates the Connecticut response was this kind of partnership, public and private, that we were able to establish in our state. And it was because of the willingness of our private partners with the state to step up that we were able to stand up a response that was in many ways exceptional across the country. I wasn't in my chair at the Department of Public Health in March or April, and so when I was talking to Josh about those early conversations between JAX and the state, he was describing to me what the impressions from that period of time, and some of the words that he used were proactive, visionary, altruistic, collaborative. And so I want to say on behalf of Josh, who was very sorry that he couldn't be here today, and all of us at the state, thank you for the work that you did in stepping up to get that testing program that you've just described up and running in such a quick time, and it's such a critical moment in the pandemic. I think Dr. AGWUNAN talked about how critical testing was in those early days. We just did not have the capacity anywhere in the country. And so for us as a state to have a partner that was able to say, we will step up, we'll put aside our current priorities, we'll work with you to increase capacity, was really remarkable and a great service to the people of the state of Connecticut. So thank you. We look forward to further a partnership, hopefully in a post-COVID world or whatever the new COVID world looks like, and ongoing conversations and partnerships with UConn School of Medicine, UConn Health, and the new public health challenges we have before us. Thank you again, and congratulations to everyone.
I'd like to read for you the words that are inscribed on the plaque in front of us. This area of reflection is dedicated to the staff of the Jackson Laboratory for Genomic Medicine and UConn Health, who during the unprecedented time of the COVID-19 pandemic came together in collaboration to conduct over 1.5 million SARS-CoV-2 tests and implement over 40,000 vaccinations to protect the health and the lives of the residents of Connecticut. Congratulations, everybody.